Several of the workshops I attended while at the symposium were presented on a theoretical level, requiring further analysis and dialogue with colleagues to bring us to a point of application. My view of the symposium overall is that it will serve our healthcare sector of the interpreting field as the drop of water that creates the ripple. Being present among fellow healthcare interpreters and other healthcare professionals produced a rich environment in which to learn, and many of us had the sense of returning to our home communities and sharing all that we could. While I'm happy to discuss in person my musings, for the purposes of keeping this summary brief, I selected one practical workshop on which to focus. I hope that you will find in it a few takeaways from which to benefit and share with your colleagues. Todd Agan, a fellow interpreter, described to us the isolations and precautions required for healthcare interpreters to protect ourselves and our consumers. From his bio, it reads, Todd realizes that there is much more to medical interpreting than just interpreting. Strong ethics, a working knowledge of medical terminology, understanding the American healthcare system, and how interpreters in medical settings play a role in public health are all issues that Todd feels every interpreter working in a medical setting should understand. I share Todd's beliefs, and I appreciate that a colleague with such a wealth of experience and information was the one to disseminate the following information about isolations and precautions. There are 4 types of isolations for patients: contact, droplet, airborne, and neutropenic or reverse. Those in contact isolation may have an illness that is spread by casual contact. Droplet isolations refer to those diseases spread by sneezing and coughing. Airborne are diseases spread via the patient's breathing. And finally, neutropenic or reverse isolations refer to a patient whose immune system is compromised and thereby making them vulnerable to us and what we may or may not carry. For this summary, I will elaborate exclusively on contact precautions. When working with a patient who is on contact precautions, you will want to be sure to wash your hands with antimicrobial soap, which is provided at the hospitals and clinics, before and after a patient encounter. You must wear gloves and a gown to enter the room and dispose of them before leaving the room. It is recommended that you leave your bag, umbrella, coat, etc. in your car or perhaps at the nurse's station, as allowed, prior to entering the room. Whatever you set down in that environment will be contaminated. It is suggested that you do not wear the shoes you wear to the appointment in your house. Some additional considerations are to choose signs that are not body anchored, rethink hugging the patient hello and goodbye, or family and friends in the room, and be aware of how the communication dynamic is affected when an interpreter is also donning a mask and gown. Further, because the gowns we wear in these situations are a light yellow color, one participant recommended that when interpreters with a lighter skin tone work with patients who have low vision, to attach a blue surgical drape over your gown to provide a more rich color contrast. Again, this summary is being kept brief as one way to plant the seed and share what I learned. Several of us from Massachusetts and other New England states attended the NSHI. I look forward to future initiatives resulting from our experiences there, and I invite any and all questions about my time at the NSHI, which was hosted by NCIEC and the Katie Center.